So welcome everyone to this MPW Live series. This is our first one starting off today, so we're very pleased to see you all with us. For those of you that don't know me, my name is Steve Phillips. I'm Director International at MPW. I'm very pleased to be hosting today's session, which, as you can see from the screen, which is how to get into medicine with NCUK and Aston University. And I'll be introducing our presenters in a moment. So as the slide says, also please do keep your microphones on mute for the respect of the presenters mostly, but also the sound quality for everybody. And we aim to have a Q&A at the end of the session, so please do use the meeting chat function to ask any questions, and we'll get to those at the end of the session today. Just a brief update from me on the UK. You might see that myself and our presenters have slightly larger smiles on our face than perhaps usually. That's because the UK now has this roadmap out of the lockdown, and we know that schools now are going back on the 8th of March, and we've been given some other dates to unlock the economy and get back to life as normal. So we're very pleased about that. The sun is shining in the UK today, so there's a bit of a buzz around, and we're all feeling quite positive and optimistic about the next few months, and we're all desperate, of course, to get back to normal. But for the time being, opportunities like this, MPW Live, is a great opportunity for you as parents and agents and partners to get some insights and to listen to our speakers and presenters today. So we have Ryan Moran with us from MPW Birmingham. He's the Vice Principal there. I'll be handing over to him shortly. We also have Jane Dunn with us from Aston University, from the Global Pathways team, and she'll be talking to you about what happens at Aston University, which is all very exciting. We've also got Adam with us as well from NCUK that will come in at the end for any Q&A and any comments that you make during the presentations. So enough of me, then I shall put myself on mute, take my video off, and I will hand over to Ryan. Very good to see you, Ryan. Good morning.
Morning, Steve. How you doing?
Yeah, really good. Thank you. Really good. As I said, I'm smiling. So yeah, lots of reasons for that at the moment. So over to you.
Good stuff. Thanks, Steve. Guys, yeah, just an extended welcome from me and MPW Birmingham and MPW in general. I just want to talk to you guys a little bit this morning about the NCUK program that we offer at MPW, and a little bit about progression routes, but just the course in general and how we support students throughout the program in order to help them to get to universities like Aston, onto competitive courses such as I'm just going to that line. For universities such as Aston and courses such as medicine, so obviously really competitive courses and aspirational courses which students are aiming for. So we understand that students, parents, agents have lots of choice, not just in terms of independent schools and colleges to send students, but also in terms of paths and routes to university. So at MPW, we do offer A-levels alongside our foundation program. But what makes the foundation program unique then? What makes it special? So we've got the small class sizes, maximum of 14, and they're often smaller, especially for the humanities-based subjects. So subjects like society and politics, for example. We have really small class sizes, which means students get tailored support and really individual care throughout the program. The use of regular assessment ensures that students aren't falling behind and they're fully prepared for both the coursework element of NCUK, but also the examination program, which is split into two halves. Each student is assigned a personal tutor. So I'm vice principal in college. I'm personal tutor for a high proportion of the NCUK students. My colleague Daisy, who's head of the English element of the course, looks after another high proportion of the students. But we meet with them each week, track their academic progress, but also to check on them pastorally to make sure that they're doing okay. We understand that coming to the UK to study is a big challenge, and some of these students are 16, 17, 18. Maybe they haven't been to the UK or studied in the UK before, so we understand the pressures and the challenges that can bring, so we want to be on hand to support them. We've got great accommodation. So in Birmingham, our accommodation is next door to the college, so it's a 30-second walk from room to classroom, so obviously really convenient. It helps students in order to ensure that they're not wasting time traveling and can be in class, not just for lessons, but also to study in a convenient way. And obviously, we like to get our international students mixed in with our domestic students, whether that's A-level, whether that's foundation. Integration is really important because, again, when they go to university, it's going to be very integrated. There's going to be people from all over the world, and just getting used to that environment, both socially, but also in terms of culture, helping them to adapt to the UK. So we can see some of the universities here, so the NCUK partners in terms of places students can access after the course. So both with Cambridge and Birmingham, we've got good progression to the top universities that you can see, and I'll show you some examples of that as we move forward. But students aren't just limited to these courses. Now, there are some fantastic universities there, but we can also apply outside of the group, and we've had success, University of Warwick, King's College London. There's some really prestigious courses outside as well as inside the NCUK partners. So just like with A-level, foundation, 1 year, but as a 1 year course can get you to a top Russell Group university in the UK to study on a competitive course. You get the NCUK guarantee. So as long as our students pass the course, which they do, okay, and usually with very high grades, then their access to university is guaranteed within the NCUK partners. You've got a bit of a security blanket there to ensure that the progression and the access to courses is there. We say a pass is 3 C's. And any student who comes to MPW and gets their head down and works is going to have no problem getting a minimum of 3 C's. Our A star to B last year was around the 80% mark, with some of the pathways getting 100% A star to B. So you can see that progression rates and success is really high. Okay, so within the foundation, we've got 4 pathways. So the business, humanities, engineering, and science. We've got the guaranteed progression to a partner uni if we pass the course. A real broad range of options. So you can see some of the big ones there: Birmingham, Manchester, Leeds, King's College. And we've got 2 programs on offer. So we've got our September intake, so our full year foundation program, which runs from September through to June. And then new to MPW this year is the January option. So depending on the recruitment in your country or when exams fall in your country, the January course could be an option, and that runs January through to July. So obviously we've got our first intake of that with us at the moment, and they will join our face-to-face lessons on the 8th of March. Minimum requirements IELTS wise, so 5.5 with no less than 5 in any component. Okay. having a good level of English is very important on the foundation. You can see even with the 1 year course, the program's still quite intense, where we're getting to university in a short period of time. So in order to be able to understand the content and be successful, I mean, it is important to have that level of English. We want students to be successful, so we have to have minimum requirements, because we want to ensure that when those students join our college, we give them every chance to progress to a top university. Other centres in the UK, around the world, they might accept students with lower English level requirements than that, but we like to maintain a really high standard at NPW in everything that we do. Just a bit of an insight into some of the staff we've got in college. So you can see on the right, this is the senior management team that I work with in Birmingham. The college has been judged as outstanding in the last 4 inspections by Ofsted, so outstanding in all areas in the most recent one. So obviously we can see the British government backs us as being a top school or one of the top providers of education in the UK. And we've got a really talented senior management team. So in the middle, you've got our principal, Mark Shingleton. Mark is heavily involved with students. So he's not the type of principal that hides away in his office. You will see him walking around the building, interacting, speaking with people. Students get to know him very well. And he also takes a big role in the interviewing process. So I know Jane's going to talk to you a little bit more about medicine and progression to medicine at Aston, but having an interview at a university as a student who's speaking in their second language, as you can imagine, can be quite a daunting process. So as a team, and Mark and Adam, who I'll introduce to you in a second in particular, they will interview each student to help them prepare. So do practice interviews, 3, 4, running up to the real interview date, just to give them an insight, and sometimes to put a little bit of pressure on them to show them what that environment is going to be like. And that's something that really adds value. We get requests from other schools around Birmingham from their students to come to this interview process to help prepare for the course. You can see that it really adds value. On the right of Mark is Adam Cross. So Adam is the author of Getting Into Medicine and Dentistry book for the NPW group. He's a real expert in the progression from both A-level and foundation into medicine courses, and he's always got the most up-to-date information about requirements. There's a myth in the UK, for example, that retake students can't apply for medicine, and it's not true. And Adam always has the most up-to-date information on what universities are accepting what type of students and with what grades. So having that insight gives our students a big advantage. On his right-hand side is James Bourne. James is head of GCSE, real pastoral asset within the college, really creative person. He heads up the art department, so art, photography, graphics. He's really popular with international students. I'm on the left of Mark, you know who I am, and then Martin Blythe on the far side, who is Director of Teaching and Learning. Those are all people who your students would get to know really well during their time at NPW. Just a quick insight into the pathways and the subjects with each one. So with the foundation, the subjects are fixed within college, and the students would choose the pathway that obviously is best in terms of progression for university. So if you wanted to do economics at university, you would want to do the business pathway, because obviously you've got the maths element. If you wanted to do medicine at university, which is what we're talking about today, then the science route, because you need that biology and you need that chemistry aspect in your application. Okay, but we do offer 4 pathways, and if you happen to have students who don't like maths as a subject, and lots of students don't like maths, then our humanities route has become really popular. It's a really successful program as well. Last year, 100% A star to B. Year before, I think it was 90% A star to B. So the succession rate on that pathway is really high. The science pathway last year, which I'll talk to you a bit more about, was 100% A star to B. So you've got your medicine, your access to medicine pathway, and you've got 100% of students achieving all A star to B grades last year on that program. So you can see that we're getting really high success rates on a difficult course that's taking you to competitive courses such as medicine. The grading system, so it's a fixed grading. It's not like A-level where it's dependent on how everyone else is doing. If you perform to the 70 to 79% level within the program, you will get your A grade. It's fixed. Students know where they stand from the start. And obviously we've got that 80%, that real target to get that top grade, that A star. A big part of the program, which again probably differentiates NPW as an NCUK provider from other schools, is form time. This was obviously pre-COVID and restrictions in terms of mixing, but this was my cohort from last year. This is our form time, so we meet as a group together every week for an hour. We go through pastoral stuff, but also university support. So looking at the UCAS application, helping them choose courses, talking about coursework, making sure that no one's struggling with anything. You usually find students are more willing to share concerns as a group when they've got each other to back them up and to talk about it. And we get some great insight into the course from these meetings. And they really add value. But again, it's really important for me. It just gives me a chance to touch base with everyone together to make sure that things are going well and to intervene if needed. University support. So, I mean, especially with the January course, we're not working with students for a huge proportion of time. So we need to get to know them really well. And we need to do that quickly. So we have weekly meetings to discuss university. We help and tailor personal statements. We help with course selection, university choice, and then we provide a tailored reference. And we've had years with NCUK where 100% of NCUK students have received all 5 of their offers. Every year it's high, but 2017 we actually hit the 100% in terms of offers received, which is quite impressive. I just wanted to share with you the email on the left hand side. So this was an email from NCUK to NPW in recognition of the quality of the applications that we sent. So it's quite small, so I'll just read it out quickly. So the applications and statements and references are excellent. Thank you for your work and support with them. I look at a large number of applications each year, and this is the best set I've seen for a long while. Okay, so we take pride in a student's application. We know how important it is, and we treat each student as an individual. We would not want the quality of our work to mean that student didn't get that offer that they worked really hard for. So each personal statement, each reference goes through a really strict process across a number of members of staff until it gets to the level that we're happy with before it goes to the universities. Pastoral support. So pastoral support is my background. It is what gets me out of bed in the morning. I love working with students on a one-to-one basis or in groups to try and help them to achieve their full potential. And it's always nice when that gets recognised as a college to say we're doing a good job. So you've just got a couple of emails from some NCUK parents, one direct to college and one through an NPW recruitment staff. So the top one is a guy from Malawi called TK, and he came to NPW, and he was a sort of student that hadn't worked very hard at his previous school, grades pretty low, but just really bought into the culture when he arrived, enjoyed NPW as a college, loved the experience, worked on the foundation program, left with all A's and B grades, went to the University of Sheffield, and Dad just acknowledges that the work that we put in order to order to help in doing that. And then the one at the top is a student from Nigeria called Iriti, who's now at the University of Manchester. Again, a student who came with low confidence after poor performance in maths at her previous school, finished with an A grade in maths at MPW and managed to go to her first choice university. So we know it's really important. Parents invest in a lot of money, but also putting trust in us to look after their sons, their daughters in a different country. So we take that responsibility really seriously and treat each student individually and help them to achieve their ambitions. We do university visits, so we visit Aston. We've been over to Aston, both to their science department, but also to their business school in the last 2 years. But also we went out to Manchester. The University of Manchester did a specific NCUK Open Day for us. Really good experiences, tours of campus. It just helps students to get an insight into the areas and the university in general, so they can make a better choice in what they do. Just like with A-level, GCSE, we have a full extracurricular program with NCUK, trips out, debating society, Model United Nations, sports teams, sports fixtures. We do this on a Tuesday afternoon. Lots of NCUK students get involved in it. It's a great way just to make friends, integrate with other students, but also just get that little bit of downtime away from lessons and have a bit of an outlet. So we try to run as many programs as possible. Success. So, I mean, everybody wants success. I want success for my students, and I know you certainly do want success for your students too. So as a college, we've experienced a great deal of success with the NCUK program. This was an award for top performing student for the University of Manchester from Iriti. So she won a cash prize. I went to the awards ceremony. Mum and sister flew over from Nigeria to celebrate with her. But just really nice to see students doing well, and sometimes even nicer when that student has come with a little bit of a story and struggled at a previous school to then get this level of success is really impressive. Results. So this was 2020, so I'm not just giving you like a random year. Oh look, I'm going to show you the best year of results we've ever had. This is just last year, and this is in line with the years before. In fact, we've probably had better years than this. But last year, 80% of students achieved A star or A grades. 50% of students got at least 1 A star. And 100% of students, so on 2 pathways, so the science pathway, access to medicine, and the humanities pathway, 100%. And this is not small numbers like 2 or 3 kids, okay? We're in double figures. 100% of them getting all A star to B grades on the course. So a real credit to the staff that I have working on the program, and of course to the students and the hard work and dedication that they've put in. And you've got a little case study on the right, so from SA and how she did when she was with us. So talking about support of teachers and small class sizes. So just nice to see that level of success. Just a quick insight into some of the destinations here. So you can see, again, this is not across lots of years. This is just last year. So you've got King's, Birmingham, Sheffield, Bristol. We've got students studying medicine at the Royal College of Surgeons in Ireland. But again, you can see there's A stars, there's A's, there's B's. So there's top aspirational grades. And a real mix of subjects too. So economics, anthropology, medicine, law. You can see it's a wide breadth in terms of where we can access and what courses we can get into. So award nominations. So 2019 into 2020. So again, in the previous year, we were nominated for Study Centre of the Year and Student Satisfaction. We've been nominated for Study Centre of the Year the last 2 years. So I'm going to have a word with NCUK and Adam, because I think if we get nominated 3 years in a row, surely we have to win. But on a serious note, it's a really good achievement, and it's a big pat on the back for the staff in college, showing that they're doing a really good job in comparison and in line with other centres around the world. Sorry, I know I've probably run a little bit over there in terms of time, but I just wanted to emphasise what we do and what support we give to students. So I think we'd probably take questions right at the end, Steve, rather than now.
Yeah, I think so. Yeah, if that's okay.
Perfect, mate. Yeah.
Good. Thanks so much, Ryan. And Adam's on the call from NCUK, so I'm sure he's made a note of your comments and he's sending numerous emails off to people as we speak.
I'm well aware. I'm well aware.
Oh, there he is.
Thank
you.
I'm a big advocate of MPW. Don't worry about that. I push for it. It's out of my hands, though, the decision for the awards.
Thank you. Good timing on that, Adam. Thank you. Thanks very much, Ryan. That's great. Yeah, and thanks for the wow, look at these results slide. That's my favorite for sure. So Jane, welcome. Thanks so much for joining us today.
Thank you.
Going to hand over to you now for the next part of the webinar, and then we'll come to some. I've had one question sent through to me by email that we'll get to at the end, but anything else we'll deal with at the end, if that's okay with you.
Thank you, Steve, and thank you, Ryan. Hello to everyone on the call today. My name is Jane Dunn from Aston University in Birmingham. I am going to talk a little bit about medicine. Medicine is a new route of progression for a foundation student at Aston. So we really welcome that development. This year, I'm pleased to say we currently have 5 foundation students from NCUK that have successfully moved to the interview stage. So I will talk a little bit about medicine, but you'll see from my presentation that I'm widening this to talk about progression to health-related programmes. And that's largely because medicine is very difficult to get into. It's highly competitive. There are very few places across the country for international students, and so it's very useful for you to have backup options, both when you're talking with parents who definitely want, they see their student, their young person as a prospective doctor, but it isn't always the way it works out. So what I'm going to talk about is the wider health-related programmes. So just bear with me, I'm going to share my screen today. So hopefully you can see that. So Aston University is in Birmingham. It's a campus university, so small campus university where students live and study on the one site. We are approximately 15,000 students at the moment. A little bit about Birmingham. Birmingham is the second city in the UK. It's in the middle of the country. On a normal year, we would look to see around about 65,000 university students, all enjoying a whole range of activities that Birmingham has to offer. It's a very diverse city. We have lots of cultural events, sports events, music venues, food. It's a place where if students are looking for part-time work, there is lots of opportunities for that within this large city. As you can see, we're in the middle of the country. It takes approximately an hour 30 to an hour 40 to get into London. So that's the blue dot. The pink dot is Manchester and the yellow dot is Edinburgh. So you can see how Birmingham is situated very well for a student to access all parts of the UK. Aston campus itself is in the city centre. So you can see the location of that on this slide. You will take approximately 5-6 minutes to walk into the city centre. The benefit of that is there's no costs to travelling around the city. You know, it's just a walk away. A little bit then around the health and life science areas that I wanted to talk about. Yes, we have a new medical school. We're in our 3rd year, and 2021 will see the first intake of the NCUK Foundation students, fingers crossed. We are the first medical school that offers a certificate, a qualification that develops the doctor's management and leadership skills. It's a unique feature, probably something that many students do not consider at the time that they're thinking of medicine, but what they will get is a certified award stating that they've understood and learnt what it is to manage community health centres, whether that be in hospital, in the community, GP practices, out in the country running various health schemes. Very useful qualification to have and could be good on the CV. We are ranked 6th for subjects allied to medicine, and that's why I'm going to bring in a bit of a discussion around other options for health studies. So pharmacy and optometry, most popular courses: medicine, biosciences, pharmacy, optometry and psychology, and I'll talk a little bit about those. So as I say, today I want to talk a little bit about the range of health related programmes. I want to introduce you as well to some of the amazing teaching staff at Aston that the health students get to meet and know. And what I did, I'm looking back at the start of their careers, where they started with their first undergraduate degree, and it will show you the journey that these staff have taken. So we have Dr. Afshan Ahmad. She's a microbiologist. She develops vaccines for streptococcal organisms and teaches on the Aston medical degree. Probably Aston is a little unique or unusual in that most of the staff continue to research their subject. So you get live research data being developed and presented to the students that are on the degrees at Aston. And she started off doing BSc Hons Immunology and Microbiology. We have in the medical school a very important research group, something that probably students are not too familiar with when they start looking at universities, but I would urge you to encourage students to look at research centres at the universities they're interested in. At our medical school, we have a research centre run by Dr. Boris Kaisela, and the focus for Aston research is in the areas of maternal health, so women and babies, cardiovascular health, so that's heart attacks and preventing them, and understanding and developing solutions and treatment for Alzheimer's and dementia. Dr. James Brown is a lecturer in biosciences and researches into metabolic diseases. These are things like diabetes. He teaches students about anatomy and physiology and hormones, and that's on the medical degree. And he started out undergraduate BSc Hons Biomedical Science. In the area of psychology and neurology or neuroscience, Dr. Nathan Riddell researches into how the brain works. Aston has a very famous brain centre, and actually MPW students have visited the brain centre, and I believe one student had a brain scan done on one of the visits. He looks into research on what affects changes in the brain when things like depression or trauma through accidents happen, and also researching around eating disorders and what it is about the brain that is resulting in a young person having an eating disorder. And he teaches students on our psychology programme. And yes, he started out with an undergraduate in BSc on psychology. For students who possibly think of medicine as their top choice, they may have also considered something like pharmacy, and we see a number of medical students that may not be quite successful getting into medicine, but will consider pharmacy as an alternative option. It's a highly paid profession, and certainly we find that our students from the pharmacy degree go on to get good graduate jobs, whether that be in hospital or in the community or in working for industry, in research, or even retail, such as for Boots, the chemist organisation. So his research is in the relationship between pharmacology and neuroscience. So the effects of drugs on the brain, how the brain functions during psychiatric episodes, so that's mental health episodes, and neurological episodes like epilepsy. Dr. Stuart Greenhill teaches students across our pharmacy team, across the neuroscience degrees, and despite having several offers to study medicine, he chose, oh sorry, I've gone on a bit too, I'm just going to go back. He chose to study pharmacology instead. He felt that it gave him the opportunity to be in the medical world, but a bit more flexibility around what he would like to research and how he saw his career progressing. So it's quite interesting. A little bit about pharmacy, in case that's an alternative option that some of your students might consider. Pharmacy is a 4-year programme, and that's because it integrates with a 1-year practice year. Aston has a very good reputation for developing and delivering pharmacy courses, and as you can see, 82.4% Aston students pass on their first attempt in the 2019 examination. It's well worth considering and advising students as a possible alternative. It's what I would call a more vocational course, so similar to medicine in that you know what you're getting qualified in. You will be a pharmacist, as in the same way you will be a doctor if you do medicine. Biomedical engineering. This is a very up-and-coming subject area that brings together specialists that work in computer science, in health, in medicine, in neuroscience and psychology. And Dr. Antonio Fratini specialises in medical instrumentation and psychological data processing. So he and his team and other teams around the country work at developing things like, you'll see that robotic heart in the picture, and in fact the hand as well. Excuse me, very interesting area of study. His research particularly focuses on improving the quality of life with medical devices like the ones in the picture and rehabilitation treatments. So this is where maybe someone has lost a limb and needs a prosthetic of some kind. So Antonio and his team and other teams in the UK and around the world collaborate on developing these medical devices that a person can use in conjunction with their own body and control, and go some way to overcome the difficulties that they have from the loss of a limb. So he teaches across a number of subject areas. His team is very interested in engineering processes needed to create healthcare solutions for the future. And as you can see, that was his undergraduate degree that he chose to do when he started out on his career. If you're considering a health-related career, so this is the conversation you have with your students, you probably like people and are interested in how we think and behave, and have some interest in developing healthcare solutions for the future. So you ask yourself, do I like breaking down problems and solving them? Do I like working with numbers and data? Because that's quite important in the health field. Do you enjoy collaboration and teamwork? Are you a creative thinker, and are you open to the ideas from other people? So on these types of courses, these degree programs, these are skills that you will continue to develop, and that are necessary in the health fields of today, particularly all of those areas, but in particular probably working with numbers and data has been quite significant in the COVID vaccine breakthroughs that we've had recently. That's a nice picture of our campus, Aston campus. The glass building is the library. The tall buildings are the accommodation, and students, as I say, will live and study on the same site. A little bit about our campus in case Aston is an option for your students. We have a brand new Students' Union building, which is amazing, with lots of facilities for downtime for your students. We have a multi-faith centre on site. So for those students who are observants of various faiths, they have a place to go and people to talk with. We have health and welfare services on the campus. I think one of the things that a campus university means is that you have lots of facilities on the site. So we have supermarkets, we have a swimming pool, we have a football pitch. And that often isn't the case in a lot of universities where you may have to travel. We take security very we think security is very important to our students, so we have 24-hour on-site security. Great facilities for students to live and study on site. We have over 120 societies, so students who have a particular interest to follow, they can continue that, but also they can develop new interests by joining those societies. And very importantly, to get across to your students that you are counselling, that the universities in the UK will mostly have a range of these student support services. Aston has a centralised face-to-face student support hub, and international students will go there for letters for banks or queries around visa or queries about finances. Each of our colleges has a dedicated student support team for queries around assessments and support and worries around the workload. We have a personal tutoring system. We have a counselling and mental wellbeing team. So if a student is homesick or has got a particular personal matter they're dealing with, they can go privately and receive some counselling support. And if someone has got a weakness in a particular area of language, or they need help with developing CV and interview and presentation skills, as we say, it's very important for medicine that you do hone up those interview skills, then we have free of charge services to provide that kind of help. So that's a little bit of Aston. Just also to remind you that if you are counselling NCUK students or potential NCUK students, Aston University has 6 NCUK dedicated awards. They are £5,000 each, and that will be for this year and for next year and for the year after. We review it every 3 years, but that's the level that we have at the moment. I'll finish off by saying that around the medicine area, the way that Aston assesses an applicant for medicine might be slightly different to some other medical schools. It might be similar in other respects. So I'm just going to run down the way that Aston assesses a medicine application. We look at initially their high school grades, so that's pre-NCUK Foundation. The student may be doing GCSEs, for example, at MPW, so we look at those grades, and that carries a 50% weighting. So if you're advising students looking for medicine and wanting to do the foundation programme, they have to have very good high school grades. We then look at the score that they will get from a dedicated entrance exam called the UCAT exam, and MPW will advise on that, as will NCUK, and that carries 25%. We also look at the results of the interview. I'll stop sharing my screen now so that I can come back to you. The interview stage at Aston is called an MMI, multiple mini interview. This mechanism is used by a number of medical schools, and I've provided some materials prior to the talk today that you can share with potential students that will help them prepare for the MMI. They are little interviews where a student is presented with a scenario, and they'll be asked a number of questions around the scenario that they are presented with. There may be some people who are acting as patients for the purpose of that scenario, and we are marking how the student interacts with that patient. So how they introduce themselves, how they listen, observe, note the state of the patient. So it's not about medical knowledge. It's about how you respond and communicate to a patient. So those are the 3 tests, and you are graded on those 3 stages. Pre-foundation, high school grades, the UCAT score, and the MMI score. The other feature, I think, of an Aston Medical School programme that might be of interest to you is the students are receiving a clinical placement practice from the first year. Some medical schools have academic delivery for 2 years and then practical. We go straight into clinical practice in the first year. I think at that stage, I will stop, because if there are any particular questions around medicine, I'm happy to answer them, but also I'm happy to have an individual dialogue. If someone has a question thereafter, then please share my email address and I can answer queries around medicine if that's the focus. But the purpose of presenting today a range of options that are in the health fields will show the student that there are these options across the NCUK family of universities. So it's a very good idea when counselling a student to look at what possible alternatives there may be if they're not successful into medicine. Thank you.
Great. Thanks so much, Jane. That's really interesting. I know you shared your email on one of the slides, but we have that as well. So if anyone is in contact with us and wants direct contact with you, then we'll just pass on your email address. Thank you. So we have some time for a couple of questions. I've had one sent through to me, possibly for Ryan or for Adam, and it's about the January start, the September start for the NCUK programme. How much more intensive is the January start, and do we get the students' expectations right in advising them about the difference between those 2 start dates?
Yeah, so
Ryan, do you want to?
Yeah, thanks, Steve. I think that's a good question, and I mean, running the course this year, I've managed to get obviously quite a good insight into the differences between them. I'll be honest, it is more intense. they've got around about 50% more contact time. So in terms of lessons, so if we looked at a January student's timetable, we're looking at about 30 hours a week of contact time, plus obviously work outside, homework, coursework, on top of that outside of lessons. Whenever I interview for a January student, I make this really clear about the level of work that's involved. And again, I've had that discussion with some of my students this year in terms of the amount of work that's expected outside of class for students to be successful. So you're signing up for a program that is less than one academic year. So from January to July, we can do it and we can give students a really good experience. But yeah, they've got to be prepared to work really hard if they want to be successful. But that's the same with any course, I suppose.
Yeah, thank you. And I guess, I mean, that does answer the question, Ryan, thank you. And it's very much done on an individual basis, isn't it, at NPW? So it's all about the first person in country speaking to that student and then handing over to you at the interview stage or the application stage, and you just making sure that their expectations are fully matched with the course outcomes. So that's really good. Thank you. Jane, a question's come through about the criteria for being admitted to study medicine. I think you covered that briefly, but do you want to add any more to that?
Yeah. Yes, I will do. From the outcome of your foundation programme, you will need to get 3 A's. I think that's the only additional information that would be required.
Okay, great. And you know, staying with you, Jane, and this is quite a broad question, I'm afraid, the big question, and this came through actually on LinkedIn. So we accept questions through any platform. When we shared the NPW Live series, a question came through, and it was about, you know, because of the pandemic, because of what's happening at the moment, have you seen, you know, big increases in demand for medical studies, and are there more opportunities, do you think? Because, I mean, we're never going to go back to complete normal, right? I think we all know that. So what do you think the future is for the people that have that demand at the moment and other opportunities?
Yeah. Well, this is my opinion only, of course, so I'll add that caveat. I know that the data is telling us that there is a significant increase in applications to degrees that are health related. So not just medicine, but nursing, pharmacy, biomedical science. It's just enthused people to want to work, you know, in the health related field. So yes, there are significant additional numbers applying this year. So the data tells us that. In terms of medicine and growth, I have heard that our government is potentially looking at increasing numbers of medical places. There's always a demand for doctors. There's never enough qualified doctors to fill the vacancies. So I think that's being discussed. It's not an easy, it's not just simply saying we'll have more places at university, because for every place at university to study medicine, there has to be 5 years worth of clinical placement. And that's where that's where we get this bottleneck of if we have a medical student, we've got to give them good quality 5 years of clinical placement. So I think that's where the expansion is needed. It's across working with GPs, working with hospitals in our regions to enable extra medical students to get the experience they want. For an international student, the picture doesn't change, to be honest, Steve. Every medical school, generally speaking, has to abide by the government caps on medical places and the requirements to train domestic medical students to become doctors. So you'll know that a lot of medical schools have restrictions on the number of places available for international students to study medicine. We run at around about 20. That's slightly higher than a number of other medical programs, but there are 1 or 2 medical programs that have a significant number more. I don't see that changing. That would be my opinion at the moment. So it will remain, I think it'll always be highly competitive, but I think it remains so, which is why I wanted an opportunity to suggest that students thinking of medicine also considering other health related programs.
Right, no, that's really good, very interesting, and good to get your opinion on that as well. Thank you. So I think one more question, which is it's not related to this particular webinar. It is an NCUK question, but it's one that was asked me a couple of weeks ago, actually, when talking about NCUK, and it can be either for Ryan or Adam from a more general perspective. So NCUK students coming through the program seem to be really well prepared for undergraduate courses that they're going on to. I mean, perhaps even more so than coming through different routes. So what is it that they go through during the NCUK year that makes them so well prepared for their undergraduate studies and first year degree studies?
Well, I mean, I'll say a tiny bit about NCUK, but I'm sure Ryan can really dig deep into how students are supported at MPW. But for NCUK, well, I mean, the course is only for international students. British students cannot take it, and so what that means is that there's the understanding of the challenges that international students face when they're coming into international education, especially British education. So the language aspects are the most clear and what you would expect, but it goes beyond that in terms of the academic delivery across all the modules. So as an organization, that's what NCUK delivers to students everywhere. But hopefully I'll hand over to Ryan. He can go into a bit more detail about MPW.
Thanks, Jason. Adam, sorry. Yeah, so with the foundation, I think some of the really important aspects of the program would be how it's delivered in terms of having a coursework element alongside an examination element, which is quite different from the majority of A-level subjects. So students are required to produce substantial essays similar to what they would have to do at university. And within those essays, they have to use Harvard referencing. So again, this is a skill that's going to be highly valued once they get to university, and having put these skills in place during their foundation year, it gives them a little bit of a head start potentially on other students who are at university. The English aspect of the program is also really important. So we don't just teach IELTS. It's not IELTS English that we teach on the foundation program. It's English for academic purposes. And we're constantly trying to help students to produce better quality work. So in terms of skills like analysis, evaluation, writing extended essays, these are all skills that are improved throughout the program, which again are going to add real value when you're going into a humanities-based subject at university, but also a science-based subject where you are expected to have the ability to write essays. Pastorally, integration, we just want to make students feel comfortable, and they do get that little bit of extra care in terms of being monitored throughout the program. It's a shorter program. We understand the challenges that can bring, so we do ensure that they're supported throughout and give them that little bit of extra advice in terms of where they go for university.
Great. Helps. Yeah, it does. Yeah, thank you, Ryan, and thank you, Adam, as well for that that input. Well, that's 10 o'clock, guys, and I do try to keep to time where I can. I know that we've all got 1,000 things to do wherever in the world you are. So thanks so much for joining us, everyone. We've got Jane's contact details. We'll pass that on to you. You can get in touch with us at international@mpw.ac.uk. and look forward to seeing you all at the next event next Wednesday. Follow us on LinkedIn and other social platforms to get the details. Really good to see your names on the call. Thank you to Ryan, thank you to Jane, thanks Adam for joining us, and have a good day, have a good evening, everyone.
Pleasure. Take care.
Thanks, guys. Take care. Bye bye.
Thank you, everybody.
All the best. Bye
Thanks,
bye.
guys.
Bye bye.
Bye.